Nilikuwa nasema maybe naweza kuja hapa na nikarudi peke yangu bila mtoto.
The sharp cry of a child is pain to the mother. Edith Kemunto remembers her pregnancy journey vividly after delivering her child 4 months ago and eventually being told that her son has a hole in the heart.
Nilipomfikisha pale sasa hakuwa amegain ile weight yenye inatakikana. Ndio baadaye pale walipomwangalia ikakuwa sasa hako mwili joto, hata ile kupumua hawezi. Kule Kilifi wakamwangalia, wakampiga scan mwili mzima, ikuonekana shida. Akasema labda shida inaweza kuwa iko kwa kidney. Wakajaribu wakapata yuko sawa. Ndio daktari mmoja akasema pale kuwa wajaribu wamwangalie moyo kama iko sawa. Lakini pale walipomwangalia akapatikana akona shimo iko kwa moyo.
The situation is not different for Beatrice Mora. A few hours after delivering her child, she discovered all was not well.
Kaanza kupumua haraka haraka na kukoa na kutoa jasho. Nikampeleka hospitali wakaniambia akona shimo kwa moyo.
Today we met these mothers here at MP Shah Hospital where there has been free heart checkups and surgeries for 2 weeks.
Sasa nasikia vizuri.
Their smile is back after their children underwent surgery. They can already tell the difference in their children's health.
Maana wakati tulipokuja ile kupumua bado alikuwa anapumua ilikuwa iko juu. Lakini sasa hivi vile amefanywa vile namwangalia basi naona yuko sawa. Hata ile kupumua at least ako sawa. Na ile temperature alikuwa nayo sasa hii kipimo imerudi ile ikonomo. Maana temperature yake ilikuwa inatembelea tio 38.4 38.5 ikielekea kwenda juu, lakini sasa hivi amempima hii inaenda ikishuka tu.
Sasa nasikia poa. Naambia Mungu ni asante. Andrea kuongezea madaktari.
Contrary to those whose children have found help here, Beatrice Adero is still in pursuit for help. She gave birth to twins barely 3 months ago. One has a heart condition. However, she has been told that her son's condition cannot be treated in the country. Her journey getting her son's help outside the country needs to take place immediately.
I did not expect that it would be that urgent. I thought it was something that could be managed, handled here in Kenya. But now I'm already late. I've run out of time because it should be done at 3 months and already he has a month to go, 3 weeks.
According to Dr. Salim Jivanji, there are different types of heart conditions, even though there are no known causes of these problems.
Like atrial septal defects, ventricular septal defects. So atrial septal defect is a hole in the top chamber of the heart. Ventricular septal defect is in the hole in the lower chamber of the heart. You can have a narrowing of different valves, so pulmonary stenosis, which is the valve separating the heart from the lungs, aortic stenosis, which is the valve separating the heart from the body. There are certain syndromes which are associated with the heart condition, but the answer to your question, there isn't a specific thing that you can do to prevent having heart condition. You're just born with it. It's part of life.
He also indicates that it would make a major difference if these diseases could be identified when a mother is pregnant, so that treatment can begin early.
If you have antenatal diagnosis of a condition, then you can plan. You can say, well, the baby is going to be born with a heart condition. We should do something around the time of birth or soon after birth, or we are aware about the patient, we can organize appropriate follow-up and then whatever operations required. But it's not as simple as that.
And to strengthen the health sector in the country, especially for treatment of diseases like these, there is a need for training and provision of specialized equipment in Kenyan hospitals.
Training, so you've got some really energetic doctors and nurses here, but it's pediatric cardiac surgery is complex. The children are sick going into surgery, sick throughout their surgery, and sick after surgery. So the skills of the medical team and the nursing team is very important to make sure they're good enough.
Some things is particularly for post-operative care, some medicines, some that really can't be offered here locally, and those cases have to go abroad.
Robbie Omondi, K24 Health Beat.